first signs that a parent should look out for is squinting and signs of eye strain by the child. Usually for young children, they tend to go very close to their books or their activities, or even the TV or the digital device that they are using. Some kids may have attention issues in class because they can't see what's going on at the whiteboard or what the teacher is trying to show. For a school-going child up to 16 years of age, it is recommended to have an eye exam every 6 to 12 months, primarily to check for any developmental issues or myopia, which is quite common in that age group. Unfortunately, most myopias are not reversible. So it is important to try to prevent the onset of myopia by having good visual habits, and also if there is an onset of myopia, to be able to take steps to try to reduce or to slow down the progression of the myopia. There are currently two forms of the treatment of myopia to try to slow it down. One of it is an optical method, which is to use specially designed spectacle lenses or contact lenses or orthokeratology to correct the way light enters the eye to discourage the eyeball from getting longer. The other way to control is using drug therapy, using a drug called atropine, which can only be prescribed by eye doctors. I would not call it an exam in front of the child. It's just an activity. It would be helpful if parents don't stress the child by saying, I'm going to take you to an eye test or an eye exam. But you could begin by explaining to the child, we'll just take you to an optometrist, and he or she is going to see how your eyes are like, and if you have any problems at all with your seeing of your eyes, don't be afraid to tell the optometrist. We want to see how they respond, not just what they respond. So it's never about a passing mark, it's never about getting all the right answers. But importantly is, if the child's relaxed, they will give honest answers. They will respond in a way that reflects how they would normally respond and be in their real world. And that's very helpful to an optometrist. There are specially designed spectacle lenses, contact lenses, and even a specialty contact lens such as Ortho-K to not only correct their vision so that they can see clearly, but also to try to discourage the myopia from getting worse.